Welcome to Scott H. Silverman's Happy Hour Podcast. Are you stuck, scared, or unsure of what to do next? If a situation with a loved one, spouse, or even a child has started to spiral, possibly becoming dangerous or threatening, it's time to seek help. Let's navigate the crisis together with Scott H. Silverman. Okay, everybody, welcome back to Happy Hour with Scott H. Silverman, and I'm your co-host, Fred Carroll. How are you, Scott? It's been about 3 weeks.
It has, and just because you get a little bit of COVID doesn't mean you should, avoid all of your responsibilities. So it's good. You're looking better, though, and you're sounding better, so clearly you're feeling better. I'm doing well.
Yeah, I'm feeling good. I'm feeling good. It beat me up a little, took me down. I'm vaccinated, whether or not that mattered. Who cares at this point? I guess.
Who cares?
I don't know if it helped, if it didn't help, I still got very sick. That's all I know. And whether or not maybe it would have killed me if I didn't have the vaccine. I don't know. I'm not a scientist.
I was doing a podcast with Brock out in Arizona, and I was mentioning your name and what we're doing, and he was looking you up, and he goes, "Have you seen his post on Facebook?" I said, "Which one?" He goes, "It looks like he's been abandoned by a family member." I guess, you kind of had I don't know if it was a share or a rant or just, letting people know that, you're now an empty nester. And it was basically me using comedy to deflect pain. Right.
Like I normally do. I was just making a point that I feel like my kids abandoned me. Look what they did. Why are they leaving? Where are they going? Where are they going? And now all she does is come over and take all my stuff to her place. That's not moving out. That's stealing.
Yeah.
I've been there for 10 hours the last 2 days putting IKEA furniture together. And now she's attempting to do it herself, but the battery ran. She came over just now, a few minutes ago. She just left with parts of IKEA furniture where she ground the screw so deep that she ground the head off. So I had to take vice grips to take the screws out. And now she doesn't have any screws. Now I got to find more screws for her. It's just one of them things. You know how it is. It is what it is.
My youngest does these things online and needs something. And, I call it virtual panhandling. And I just said, the family plan has boundaries. Please review the agreement. She goes, "I threw that agreement out. It didn't make sense to me."
Yeah. Is that the lawyer?
No, not the lawyer. The special events coordinators. That's what she does in New York. So
did you have the lawyer draw up the paperwork? You should have had her draw it up.
It was a fictitious statement. It was a joke because we try to help where we can with our kids. And I just said, look, don't take advantage of it. Just know that whenever we can, we will. And if you ever have an emergency, we'll try to be present. And it was just funny because, she talks about the family plan. I go, it's time for you to get off of, Verizon. Yeah. Well, no, I really respect the family plan, Dad. I want to stay on the family plan. I think we all benefit from that in a great way. And she, tries to make it sound like, she's doing God's work by staying on the family plan.
That's right. She's helping you. She's helping you.
Oh yeah, I cannot get a value added opportunity like she offers with that kind of commitment to the family plan.
It's amazing the bartering skills they come up with too. Now she's like, "Listen, I paid for the furniture and stuff like that, and you were sick, so you weren't able to help me move. You think maybe you could buy me a TV?" Yeah. That's her barter. And what did I do? I just bought her a TV. So I'm a softie, Scott.
Well, it's a good thing. And then when it breaks, it's your fault.
Yeah. Why'd you buy that TV? Should have bought a better one.
I'm just texting our potential guest to see where he's at because I know he's in a different time zone.
Yeah, that's okay. If he shows up, we'll record. If we're recording anyway, so it's just you and me. So what's been up with you? Have you been staying busy?
Yeah, I have. It's interesting. I just got a book called Adrift by a guy named Scott Galloway. And I don't think I've actually purchased a book to read in a long time. I'm looking forward to reading it. He was just talking about how everything's so politicized right now as a country that we're just, we're not looking at each other as human beings anymore. So that was kind of interesting. And obviously the area that I'm focused on, these new Skittles, fentanyl, there's a huge scare out right now about kids getting this at Halloween. And they're really trying to build the DEA and an awareness campaign about being very, very careful about these pills because they look just like candy and they're all different colors. So they're being manufactured, I've been told, out of China. So they're really working hard to keep our American population at least curious, if not addicted in many ways.
So from a devil's advocate standpoint, what's the benefit of somebody giving children fentanyl candy? What kind of person is doing that? Drug addicts aren't doing that. Addicts aren't giving their drugs away.
People that are angry, I guess, people that are scared. I don't know if you remember years ago, there was this big scare. We had a lot of it here in Southern California because of the park system. People were putting razor blades, literally just scattering them on the ground. And kids were walking barefoot, dogs or cats were walking around and they were getting cut with these razor blades. And it just didn't make any sense, but it was going on a regular basis. And, who would do something like that? But the thing is, people do that. And, poison candy or putting some sort of contaminant, that's not been uncommon. That's why they tell you never take anything that's unwrapped at Halloween. But the fact that someone would be doing this, it would just be someone who's deranged, not normal. I mean, how do you explain a young person that goes into a school with a weapon and does what they do? So, what is it? They said something like only 15% of the population has really got some catastrophic thinking going on that would do things like that. Well, that's a lot of people when you add it up.
I personally would rather them focus on taking the drug off the street every day of the year rather than just focusing on Halloween. Because I don't think Halloween's going to be the problem, because kids eat candy on Easter. Kids eat candy on Thanksgiving, on Christmas. That's not going to stop it. We have to get into this China stuff. We have to stop it at the source. If we keep trying to stop it at the second source, they're just going to find a new way. It's going to go to Seattle. It's going to go to somewhere else. It's going to come in on the border somewhere. You can't patrol the whole waterway. So you have to go to China. China has to they have to be a part of this solution.
Well, you would think that if you stop the manufacturer from making it, or you can, convince the manufacturer to stop making it, that would cut it off. But what's happening with fentanyl, unfortunately, you can get the materials on the dark web, and a lot of, fentanyl, because I just was asked to make a public statement about our president and fentanyl. And, and I don't believe it's the president's fault. I don't think it's a political issue. I just think the demand for people to self-medicate in the U.S. is so great. The manufacturers are just finding in every and any way they can to get the product here. So, example, you can order it online and you can get it delivered to your home through USPS. So that's not necessarily where the large quantities are coming from. But then on the other hand, I've heard stories about shipments coming in containers going to Waukegan County, Kansas, and then they open the container and these packages just need an address and they're sent out, and they have a little payment slip in there. And the person who wants to buy more sends either money order that uses, some sort of crypto electronic money, and they buy more and they get it mailed directly to their home. So there's a lot of people in the distribution business, but they're, China and Mexico are still the key manufacturers of a lot of the drugs that are out there, and they're mixing, traditionally illicit drugs, mixing it with fentanyl, and they're shipping it out a variety of different ways. I mean, I think you and I talked about this last time we spoke. 70,000 cars come across our border here in Mexico, and only 1% are inspected. And you can't inspect every vehicle. If you did, you'd have a parking lot. It wouldn't be a border crossing. So, and talking to my friends in criminal justice colleagues, they're making busts like they've never seen before. You hear about these things in 1 million pills or enough fentanyl to kill millions of people. So they're doing a much better job catching more, but statistically, they only catch 10% on their best day. So if the 10% is increasing, so is the 90% that's getting through. And it's coming, from every border that can happen. It's being shipped here. It's coming probably USPS, it's coming UPS, it's coming FedEx. And the Postal Service will tell you in New York, where a lot of it comes through JFK, they don't have enough people power to inspect every single package. So
yeah, I just don't. I mean, I'm not in that world, in the drug world or anything where I'm doing drugs, or I have a lot of friends that do. I just don't hear, I hope there's fentanyl in my drugs. I don't understand the value of it beyond, because it takes so little to kill you. Even adding weight, I don't see the value in it, because how much can you put in it and stuff? I don't understand what it's
you
doing.
don't need much, a couple of milligrams. I mean, it's very, very small amount. And a lot of it's, people are taking medication and it's an accidental overdose, which means fentanyl is in the illicit drugs, all being made that way, with the idea that someone's going to get more addicted more quickly. But the problem is the quality assurance of the manufacturer is so poor, it's killing the consumer, if you will, their end user. But at the end of the day, most people aren't addicted to fentanyl that are accidentally overdosing. They are just they're at a party, it's a social event, they're going to do something, it's episodic, a friend's got some Xanax or even methamphetamine or cocaine or even heroin that's laced with it, and they go to do what they've always done, or they got excited from some peer pressure, they put the medication in their body and they die. And so it really is going to be up to the human to make an informed decision to not put a product in their body that could kill them. So no matter what we do at the border, no matter what happens at the airports, no matter what we do with USPS, someone's going to make it. It's always going to be there. And we as a community have to educate our young people to know they have to do better and be better when it comes to putting a poison in their body.
Right. Yeah. I guess I don't see it the same way as you, because you're so involved with it from a political standpoint out there and the police and all that. I'm not as involved beyond this in anything locally or anything. And you just don't hear much about it. One thing you don't hear is, you hear about the busts, but you never hear about the arrests. You don't hear the future, what happened to, Bobby Jones that they caught with 1 million pills. Where is he? Is he out back on the street? And that's what I'm getting the feeling is, they're not giving there's not a harsh enough sentence. Sometimes I wish they just have a death sentence on these things.
I think what's happening is there are, our local DA is going after people. If somebody gives somebody or sells somebody a product that kills the person, they're being charged with murder, and they're getting some tough sentences around that, which they should. The difficulty is because it's the dark web, and because it's illicit, and because it's a product that could go through a group of hands to be distributed, it's hard to come back to the source. And it's not like cocaine, for example, it's made usually in South America. It's a leaf that's grown, there's transportation, there's distribution. It's easier to kind of track it, if you will, and it's also harder to make it, more expensive to make it. So other things have come in that are kind of being substituted for the cocaine, if you will. So what happens is it's become more prevalent and more people are making it, and it's really inexpensive to manufacture. It's a synthetic opioid. So you don't need to start with a product that has to be grown, processed, and then manufactured. You could just assemble it in your garage if you have the right materials. So kind of like when crack cocaine first came out, but crack cocaine people weren't overdosing on. And it's like the legalization of marijuana conversation now. THC content in marijuana is higher than it's ever been. And it makes some people sick, and there are people overdosing from it.
Yeah.
So I think we just need to find a way to really get an education campaign that's just so resistant and so resilient resilient, not resistant, that people really are getting the message, and at least they have the switch they can flip in their brain to go, you know what, I'm going to make a decision not to do this, or I'm going to find a way to get a fentanyl test strip that I've heard about and test this stuff before I put it in my body.
Right. And they do have a formula set up already from work off of, and that would be what they did with cigarettes. So the kids don't smoke anymore. I mean, I've asked my daughter, I'm sure you growing up and me growing up, you were a smoker, I was a smoker.
Yep.
You smoked right in high school. Literally, we had a smoking area at high school. I asked my daughter once how many times she's walked into the bathroom and caught girls smoking. She says, I've never seen anybody smoke a cigarette on campus. And I was like, what? That's all we did. I mean, we used to go into the teacher's lounge and smoke with the teachers and stuff, but they priced cigarettes. Now cigarettes are legal. They priced them out of the children's market. They made them so expensive and taxed them so much that if you want to smoke, you're going to spend $12, $13 a pack. And that was too much. And I don't know what they could do on the drug side to make maybe the price too much. You know, there's got to be a fear base somewhere, but it's definitely it's got to start somewhere. I just don't know where the right place to start, whether it's with if you go right after fentanyl, or is fentanyl just a runoff of something else because we've addicted Americans off of other drugs prior to this.
You know, there was an article I just read last week that said up to 97% of America is suffering from some mental health issue right now due to what's taken place and compounding with the pandemic and the stresses. And one of the interesting part of the articles is one of the major stressors is the political noise that's going on right now. And of course, with social media, young people being impacted from so many different perspectives, it's hard to ignore it. And if you're not processing it, and how would you, it's like, I always joke about wanting to, drink out of a fire hose when it comes to helping people, that the information's coming at us so fast, and it's so angry and frustrating and tainted or politicized, if you will, that it just, people are finding ways to self-medicate. People are finding ways to numb themselves. People are just finding ways to try to feel better. I think that's the motivation. The difficulty with that is the things that they're getting a hold of today, if it's not prescribed by a medical professional, creates a real opening for the kind of things that we're seeing.
Yeah, it's a struggle. I mean, we talk about this every time we're on, that all we're doing is giving the news. We have no answers ourselves beyond just talking about it. Hopefully this helps a little, or somewhere, but I don't see an end to it because I don't know where it began. I don't know enough about it. That's an education thing. I'm not being educated and I'm involved in it. And so I got to imagine someone like my daughter, who I'm assuming isn't a drug user in any way, as far as I could tell, doesn't even know much about it. Doesn't even cross her mind because she doesn't do it. Now, maybe because her mother, with the overdose, death of her mother and stuff, maybe she's educated herself on that, but that wasn't fentanyl related. My ex-wife wasn't fentanyl related. It was truly, well, according to the report, she just mixed one too many pills with one too many pills. Her sleeping pill mixed with her Ambien and mixed with Xanax, and just put her over, stopped her heart, basically.
Yeah. And that was kind of a traditional prescription drug consumer who, probably originally started with, one reason or another, getting a doctor or having a doctor write an appropriate prescription. So, and that's a little different. What we're seeing today is young people, 18, 19, 20, 21, they're at a party, they pick up a pill, and that pill may be laced with something that could kill them. And that's very unusual. And it is fascinating that we're not seeing it slow down. And another statistic I just heard from a study that was done, that for every person who overdoses, 14 people have an overdose reversed. So clearly we're making some headway, but when you think about that is incredible.
Yeah, it's alarming. It's alarming, and it's probably more alarming because we don't have a solution. There's no, even just talking doesn't do it anymore. Talking isn't it's not enough. You can't just tell your kid, don't do this. That hasn't worked in ever. I mean, my parents used to tell me all the time, don't drink at that party. First thing we did was drink at the party. We just learned how to hide it. And that's the problem. We're so scared of the repercussion that we just hide it. And I don't know. I don't know.
I would like to look, I'd like to invite our listeners, our viewers, people who hear this message, let us know what are you doing in your community? What's happening with your family? I mean, right now, 1 in 5 families are impacted by this. So I'd like to hear from people giving us ideas, suggestions, things they've tried that have worked, or families that they've, worked together to try to make changes in their community. Is it their legislative leaders? Is it the media getting involved? What do they think? Because you know what? You and I've been talking about this for a while, and I'd love to hear some new ideas, new thoughts. And I look for them every day, and they're hard to find. I mean, Alaska just got a large settlement, I guess, and they put out this ask and said, we're looking for ideas to deal with this opioid crisis. If you've got one, let us know. So I had some PR people kind of send them a letter and see what's going on, or an email. Haven't heard back yet. I've tried to get my own mayor here, no response, nothing from San Francisco. And these are 2 cities in California that have created, making it a public health crisis, the opioid crisis. So I'm not getting an audience with the change agents. I have a really cool call I can't really talk about on Thursday, and I'm hoping I can convince someone to help raise the bar to get the messaging out there. But I got to tell you, it is pretty scary. It's kind of like, watching the news. They're going, well, this one's doing that again, and this one's doing that again, and they run that every 15 minutes, but nothing's changing. I mean, look. I don't want to get into a political conversation, but look what's going on with Herschel Walker. And, the kind of things that they're saying, the kind of things that he's denying, and the kind of support he's getting from others. It's amazing. If 10% of it's true, it's amazing.
Well, it's a blind support too. And you could see the politicized part of it, because his son, who came out against him, he's receiving messages from other Republicans saying, hey, son, don't you love your country? Talk about this after the election. Hey, son, trying to tell him, let's sweep this under the rug a little. And that's neither Republican. Democrats are doing the same bullshit. It's all crazy, this politicizing everything. And I think that's a problem with the drug issues we're having. Even goes down to Biden, right? To Biden. Everybody wants to blame the president for everything. And that's great. That's what you sign up for. You get the credit for things you didn't even do, and you get the blame for things you didn't do. That it goes both ways. So he signed up for this, but I don't think there's votes in drugs. I don't think him coming out saying we're going to fight the war on drugs, I don't think there's votes in that. And we're in voting season now, so people aren't talking about this. There'll be a spattering, a few, but I don't think that's going to get them elected. People want money. People want their gas down. People want to be able to heat their houses. They're not worried about the drugs right now until it's their problem. It's
well, have you seen the polls of what people, are talking about is most important to them? You're right. You just pretty much read off most of the list. Homelessness isn't on that list. Well, look who's coming in.
Yeah.
And, nor is the opioid crisis.
Yeah.
Speaking of the opioid crisis, here comes Larry Kenmore. Oh,
Mr. Larry Kenmore. Hi, Larry. How are you?
Well, hello, everybody. Scott, I just sent you an email. I thought it was 3 o'clock my time, 1 o'clock your time.
Where are you? Where are you, Larry?
I'm in Arkansas.
Arkansas. What's that? That's Central?
Central time, yes. So am I right or wrong?
No, we start at noon, the PST time, 3 o'clock
Eastern
time.
Okay.
That's okay. No worries. We started recording without you. We're actually talking now. So we bring you on, and we're talking about this fentanyl issue. We're talking about solutions. We're talking about banging our head against the wall, trying to figure out, where do you begin? Do you begin in China? Do you go to the source? Do you go to the house? Is it the parents' problem? Give us some answers, Larry. What do you got?
Well, so you're talking like this is a very big, broad subject for one, and you just opened up a really large door. What I would say that it takes a number of programs and projects to address that issue. I don't think that there's any one program that's out there that has worked so far today. In fact, there's data that shows every program that they've tried so far has not worked. So we do know that what's being done has not worked, but that doesn't mean that some of those programs put together in one project would not work, where they talk to each other and work with each other, versus what they're doing right now is operating in silos. And so operating in silos doesn't get anything accomplished. And the data speaks for itself, is what we say at Rotary. The data speaks for itself. All you have to do is look at the data and see nobody has been successful with any one program that is out there as of right now. And, you know, everybody's throwing all this money around that they're getting from the settlements. And our prediction is that when all of it is spent in 3 years, 5 years, 10 years, or whatever, it still will not have made a difference, because distributing the money is not putting requirements on the people that are receiving it.
And you know, what was it? One of the states got a huge settlement, and they were going to build a new hospital. So Larry, thanks for joining us. We are recording now. So before we go a little further, and we have a limited time today, sorry about the mix up of the time, but I know you've got some great nuggets. First of all, just quickly tell our audience, and know that you're going to get a copy of this. So what is Rotary, for people who may not know? And God knows it's hard to believe that somebody would be out there doesn't know, but there are people that don't know what Rotary is. So a little bit about Rotary, a little bit about you, and then a little bit about the effort, because I think that's important. So when people see this, they'll be able to at least go, that's helpful. So, and to, you know, we don't expect you to solve the opioid problem today.
Thank you.
Although I have a lot of support in you, and I believe in you, Larry. I think of you as Dr. Solution when I think about you and the work that I know you're doing.
Stop it.
Yeah.
So here's the issue. Rotary is a organization that works in local communities that have local clubs that take on projects. Rotary is best known for eradicating polio worldwide. There was only 3 cases last year worldwide, and there'll probably be less than that this year, we're thinking. So, you know, it's pretty well been eradicated with that number. And so because of that, Rotary has looked into this issue of the opioid crisis the last 12 years, what people have been doing and trying to do, and decided that this is a project they could do, because it was the same thing with polio. Lots of people tried different things and it didn't work. And suddenly when Rotary got involved, started having success, as you know, Bill Gates came forward and he's put up hundreds of millions of dollars just because of that success. And so we looked at the opioid issue as the driving issue for us to do something. And so the Rotary Action Group for Addiction Prevention was formed. It is a worldwide organization. We have a leader on each continent. I'm the leader for North America. And so we have put together, based on the 17 volumes that Rotary has collected over the years of how they eradicated polio, we took those 17 volumes, kind of took them apart to see what worked, how it worked, why it didn't work, what the pushback was, and then looked at what was happening with the opioid crisis since about 2008 forward, and every one of those programs that they came out with, what they did, how they did it, why they didn't work, and figured out it is going to take 5 projects in one program to address this issue. And we're hoping to eradicate it by taking those 5 projects in one program that talk to each other, work together, and in a local community, community by community, to solve this issue. No government program that they're going to come out and spread across the United States and however they do it is going to solve this, because first off, they don't require anything from them to show that they've been successful, or if they're not successful, they don't get the money. So everybody does programs and spends the money, and we're no better off than we were 12 years ago. With us, Rotary is big on data, big on numbers, and our project is overseen by 3 professors in England, and they review what we do, how we do it, the data, what we're doing with that data, and what the data is showing. So it's actually we call it peer reviewed data. So it's been reviewed and they know exactly what's going on and why. And so that's how Rotary came into existence with the opioid crisis, based on what's previously happened with the polio, and taking that playbook and really making a new playbook based on a lot of that material that we believe, and we know we already are beginning to see some success from this in individual communities. And I'll give you an example. We do know that in 2019, there was a slight dip in the opioid deaths, and nobody has talked about this. Nobody has actually researched it to figure out what caused that dip. Well, we did at Rotary. We did all the research with these professors from over in England and discovered that there was massive amounts of naloxone training and distribution going on right before COVID. And that directly correlates that number to the number of deaths that took that dip. And as we know, COVID came along, all that training and distribution stopped for 2 years, and the 2 years shows an escalation again in those numbers. So we do know that one of the things that's going to help with this crisis is naloxone training, lots of it. And we get lots of pushback, community organizations saying, oh, we do that already. Why do you need to do that? And I always go back and say, well, in 2022 in March, Lancet magazine came out with a research study that shows no community in this United States is doing even 10% naloxone training that needs to be done to save lives. So we're just trying to add to what you're doing so we can raise that number above 10%. And so that's what Rotary has been really successful in the last 4 to 6 months on, is the naloxone training in the local community, where people know it's there every month. It's on a regular basis. It's in the same place. They can go get trained. They can go get naloxone. It will be distributed in that community. And so we're seeing lots of success with that.
Yep. I was just sharing with Fred that, I was at Mobilize Recovery a week ago. That's the big 3-day event that was going on that, Ryan Hampton and his cohorts put together. And one of the speakers had mentioned that for every overdose that has caused a death, there are 14 overdoses that have been reversed. And naloxone is the only thing that I know of that reversed that. So that is a really good sign. I don't know where that information came from, and it would be interesting to see. Maybe that was from the study you guys all did.
It was from the Lancet study. That is very true.
Okay.
So what does that tell you? That tells you there needs to be more naloxone.
And the facts that came up in this presentation over a few days with some experts that were talking, people like Marty Walsh was there, and Patrick Kennedy, and people who are sitting in positions of strong, leadership and potentially influencers, that the data that we're getting around information for addiction, for example, or morbidity rate, anywhere from 1.5 to 2 years old, and that we have to get real-time data, like, with the pandemic, if you will, with COVID, where every day where the death was, in what city, what time, and what the count is. So until we make it that important, to your point, I don't think we're going to see a real systemic change. So the big question is, how do we do that? And obviously Rotary, is taking a leadership role, but what can we be talking about to get, and it seems like government, all they want to talk about is re-election and politicizing everything, but they have a lot of power. And obviously, in many cases, they're going to be the ones that are going to have to find the funding to sustain the settlement money from the opioid crisis. So, how do we find a way to weave that web? So the work that you're doing, that, and I've just joined your team, and I, did because we need to scale this. We need to create systemic change. If more people are dying now daily from opioid overdoses than from COVID, then we know that we've seen a trajectory and a pivot here that's not going down. And right now, it's a lot of it's just kids taking pills that are, counterfeit, and they're overdosing, unbeknownst to them that they've got a dose of something highly deadly and poison in their pill, and they're not checking, or they're not hesitating, or they're not avoiding.
So here's what we see. Rotary took the lead in the issue with polio, and the governments stood aside. And when they did, is where the success came from. What we see in Rotary and the Rotary Action Group for Addiction Prevention is that the only thing that is happening with government and funding right now is to try to figure out a way to lower the number of deaths. If we lower the number of deaths, it will take it out of the spotlight. It won't be in the news anymore, but we still have a problem, and that's not going to solve the issue. And so that's all that's happening right now is governments are just looking for a way to lower the number of deaths, to say, oh, look, we did something, but that didn't solve the problem of addiction, because addiction is still going to be there. And it doesn't matter whether it's drugs, whether it's cannabis, whether it's alcohol, whether it's sex, whatever it is, addiction is still there. And that's what Rotary is about addiction prevention. So we are working on both ends. We're trying to attack the crisis that we have today, but we also have our education programs that we're working on the other end, that we're working in the local schools to start educating our children. So by the time they graduate, they've had 12 consecutive years of education about what addiction is and why you would not want to do it, and how to know what it looks like and how it comes. And that's what's not available, which is Rotary is providing through a collaboration agreement with the Rotary Club of Newport Beach, California, in a program called Agents of Influence, which is a Rotary Club of Newport Beach is made up of videographers, gamers, and everything from all over the United States that belong to that local club, but they collaborate on putting projects together for Rotary, and they're very up to date, very user friendly, and they've created this Agents of Influence school education program where every year, whatever grade level they're in, they're going to get that grade level training, versus having just a school-wide program as we did in the past to just say, no, we're talking to first graders the same as we're talking to 12th graders, and that doesn't work. And so we do know that we need a school education program. If we lower the number of people that are becoming addicts, we're going to have more money, more funding, more facilities available for the people that are addicts today. And so Rotary's issue is that don't be fooled by what the government is doing, because all they're trying to do is lower the number of deaths to say that they've done something, but they have not attacked the actual issue of addiction. And that's what that's the job that you're in. You know about addiction. And so, I mean, we may be solving deaths, but we're not lowering the number of addicts. And the recent number is in 2021 to 2022, we lost 106,000 people, but we added 1.4 million more addicts. So that means we're not going anywhere. We're going backwards. Even if we lower the amount of deaths, we're still going backwards until we also attack the becoming an addict in the very beginning. And so that's what Rotary is doing, is having this age-based education that is very up to date today, something that they can relate to.
Got it. You know, the idea of addiction, it's different than, if you will, COVID, because there's a vaccination for that. It was created quickly. So we know as a country and a world that if we take a position, we're able to create systemic change pretty quickly. But a lot of resources and time and expertise were thrown at it. And I think we need to do the same thing. But addiction, in my opinion, is a disease, and a disease can be treated, but we need to have that education and the treatment available to anybody and everybody. And I think, you know, when we interviewed Gupta a couple of weeks ago, he talked about, you know, it's got to be part of medicine. It's got to be part of, we need more medical experts out there. We have to incentivize the AMA to start creating people who can really understand it and treat it accordingly, because it is treatable and it is manageable, just like diabetes.
Absolutely. And
you know,
as
we
Dr.
have
Duca
hope.
probably told you, 85% success rate for people that are in addiction. I mean, we have been to his office. We've sat in his waiting room. We've watched the people come and go. He's been doing this 17 years. And I could tell you, these are people that have been in treatment for 10, 12 years. And they're like you and me, Scott. I mean, they look like normal people. I mean, one lady works for the city. She's been there 15 years, got a great job. She's in treatment. She is alive. She has a family. She has a job. She drives a car. She's a normal, everyday person. And as you said, it's just like diabetes. It needs to be treated, and there's treatment there. But the problem is that I'll give you an example. We have a United States congressman that we know that has a son that has been an addict for 10 years. And the first question we brought to him was, what treatment has he had? And they looked at us with this blank stare like, there's no treatment. Yes, there is treatment. Really? Can you get him in treatment? Well, that's the second problem, is trying to find treatment that's available where he lives. And that's another part of our Rotary project. One of the programs is providing databases in local zip codes of treatment and recovery that is available that they can look up there. Give me an example. A lady we talked to about 6 months ago told us that she had sent her daughter, I forgot where it was, in Florida somewhere, $35,000. They told her in 45 days she's going to come home and be cured. She wound up spending over 4 years over $180,000, and none of it cured her daughter. None of it. Because she didn't know where to go or where to look or to see who's verified and who's not verified. And that's another reason that Rotary, before we put something out there, we're going to look to see if these people have been verified by people that verify these types of organizations and say, this is what their success rate really is. It's interesting. People don't realize there's already been research done for the past 30 years that shows there is no difference from 30 years ago to today in the success rate of any program that's out there. 34.4% is the average over 30 years. It has not changed. So anybody says I got a 99% success rate, somebody blowing smoke somewhere.
Yeah.
Because the research proves that is not so.
So Larry, since we got to wrap up in a few minutes here, after you had mentioned your naloxone and all that stuff and the training in the towns, so I was spending time, I was online talking to the mayor of my town while you were doing that. And I was asking him, I live in a very small town, small, wealthy town in Connecticut. And he says, we don't even have it. We don't even have we do have Rotary. We have a Rotary club out of the Italian club downtown. So he just invited me to meet him for coffee right now. And I'm going to go meet him, and I'm going to talk to him about this program, about getting involved with it. Of course, he's in the middle of a big election right now, which is a problem for this. Scott and I were just talking politics. Talking about drugs doesn't create votes. People don't vote. People don't vote for politicians that solve drug problems. They vote for politicians that put money in your pocket.
Right.
So it is a problem at this time and moment, but we definitely would like to have you on again. You got anything else, Scott, you want to ask? Or you?
No, I think that's it. I'm glad we got Larry here. And Larry, just real quick, I'm going to make a connection with you. I met this. It's a national resource funded by SAMHSA. And while I was on this conference, I quickly emailed my colleague who emailed them, and they responded within 10 hours. And we talked with them within 2 business days. And they're funded by SAMHSA to share information about the opioid crisis anywhere in the US. And, you know, they may be a potential, you know, just a book on the shelf or a resource, but I'll make that connection for you. Because I think, you know, SAMHSA is probably one of the biggest databases in the country, and they're funded by the federal government. And I know, you know, think of it as a shut up program, but they want to, you know, shut everybody up, but at least they've got the library and they've got a lot of data as well that might, you know, get them on board, and maybe they can take some ideas and suggestions from Rotary. But anyway, Larry, it was great seeing you today, and I'll see you later
Fred,
today.
Real quick, Fred, what's the name of that city in Connecticut?
Branford, Branford.
I'm going to contact the Rotary Club there.
Yeah, see if they got anything going on. He's not a part of Rotary himself, but because of his because of his politics, but he says he has many great friends involved in the group, but it's something that he says it's a big issue and it's something we need to talk about. And he said, let's meet up and we'll talk more about this after the election, of course.
Sure.
But we'd love to have you on again. I think you're very informative. Unfortunately, we're on a hard pressed time here because Scott's a busy man.
Yes, he is.
He's a jet setter. You know, that's the type of guy he is.
Okay, Scott, Fred, it was good meeting you guys.
You too. Okay, and I just want to tell everybody, if nobody has told you they love you today, we love you. This is Scott Silverman, Larry Kenmore, and I am Fred Carroll, and we will see you again next week. Thanks, everybody. To learn more about Scott H. Silverman, you can visit his website at yourcrisiscoach.com. That's yourcrisiscoach.com. Scott is available on all social media, and if you need to speak with him, call or text 619-993-2738. Happy Hour with Scott H. Silverman is co-hosted with Fred Carroll and produced by VENOM STUDIOZ, copyright 2022. All links for each show are available in the show notes, and we will return next week and hope to hear from you soon. Thank you for listening to Happy Hour.